Have you heard of the phrase 肝肠有余,脾不足? It translates to the liver often being excess while the spleen is deficient. So this TCM concept can be very relevant when it comes to children's digestive issues. The liver in TCM is responsible for the smooth flow of energy in the body, and it helps to regulate emotion and digestion. So when we say liver has excess, it often means that the liver is overactive and it exploits the function of the spleen. And this often leads to diarrhea, stomach distension, and even pain. The spleen system, on the other hand, plays a crucial role in digestion and production of vital energy in blood from the food that we eat. So when spleen is deficient, it means that it's not functioning at its optimum, and this can lead to issues such as poor appetite, fatigue, and even difficulty concentrating in children. And it's common to see infants with colic issues, bloating, diarrhea, and even vomiting of milk. So this imbalance of liver and spleen is often the cause of digestive issues in children. So this includes pediatric tuina, shower tuina, which is suitable for 6 months to 6 years old. So after a consultation, we will use gentle strokes targeted at acupressure points, focusing mainly on the hands, the fingers, sometimes on the limbs and at the back. So these technique includes gentle strokes, kneading, rubbing, and pressing of the acupoints, and it's tailored to your child's unique needs. Each session will usually last 10 to 20 minutes, and it looks like this. Herbal medicine. So we will tailor herbal formulas to strengthen the spleen, resolve dampness, and promote digestion. We will put the sachets onto their belly button and also under the sole of their feet. The herbs will then be absorbed through the skin to elicit its effects. And also, of course, acupuncture. Acupuncture is suitable for kids as well, and it comes down to the comfort zone of both the parent and the child. And usually these sessions will be shorter than the average adult session, so just 15 minutes or so. TCM places great emphasis on diet to both prevent and manage digestive issues. So you want to focus on having 80% of warm cooked meals. So food like porridge, soups, and softly cooked vegetables are easier for the children's digestion. Cold food or raw food, especially in excess, can weaken the spleen and lead to bloating or diarrhea. And also focus on eating small and frequent meals. So instead of large meals, you want to eat smaller portions to avoid overloading the digestive system. Don't let them overeat, and also don't force them to eat as much as possible, so they don't have a negative association with meal times. And another important tip is to chew well. Encourage your children to take time while eating and chew thoroughly. Chewing 20 times for softer food like rice and vegetables, and 30 times for harder food like meat. And also, if your child has a lot of phlegm, avoid dairy for now, because these can create dampness and also weaken the digestive system, contributing to bloating or indigestion. So for the time being, maybe you want to swap for soy milk or goat's milk. And if they must drink milk, make sure it's warm. Just give half the usual amount and not before bedtime.